How are bladder tumors classified based on their growth patterns? Have you ever wondered how bladder tumors are categorized? Understanding their classification is vital for treatment and prognosis. Bladder tumors are mainly classified into two categories based on their growth patterns: non-muscle-invasive bladder cancer and muscle-invasive bladder cancer. This classification is important because it reflects how deeply the tumor has penetrated the bladder wall. Non-muscle-invasive bladder cancer, often referred to as NMIBC, includes tumors that are confined to the inner lining of the bladder, known as the ileum. Some may invade only the lamina propria, which is the connective tissue beneath the lining. NMIBC is further divided into subcategories, including TA, which is a non-invasive papillary carcinoma, and T1, where the tumor invades the lamina propria. There is also carcinoma in situ, a flat, high-grade tumor that remains confined to the ileum. These tumors typically grow superficially and do not invade the muscular layer of the bladder wall. While NMIBC has a high recurrence rate, it has a lower risk of progressing to muscle invasion compared to muscle-invasive bladder cancer. On the other hand, muscle-invasive bladder cancer, or MIBC, involves tumors that invade the muscularis propria, which is the thick muscle layer of the bladder wall. MIBC is classified as T2 or higher, indicating deeper invasion into or beyond the muscle layer. This growth pattern is linked to a higher risk of metastasis, meaning the cancer can spread to other parts of the body. As a result, MIBC often requires more aggressive treatments, such as radical cystectomy, which is the surgical removal of the bladder, chemotherapy, or radiation therapy. Unfortunately, MIBC generally has a worse prognosis compared to NMIBC due to its invasive nature. Additionally, there are specific growth patterns within these classifications. Papillary tumors grow outward into the bladder cavity, forming finger-like projections, and are commonly seen in NMIBC. Sessile tumors are flat and broad-based, often associated with carcinoma in situ or more aggressive disease. Nodular or infiltrative growth patterns are observed in more aggressive tumors that invade deeply into the bladder wall and surrounding tissues. Understanding these growth patterns is crucial for managing bladder health. They guide clinical decisions regarding surveillance, intravesical therapies, and surgical interventions. For instance, intravesical bacillus calmette-guerin treatment is a common approach for high-risk NMIBC. It stimulates the immune system to attack tumor cells, helping to prevent progression. In summary, bladder tumors are classified based on their growth patterns. Superficial tumors confined to the lining or connective tissue versus those invading the muscle layer. This classification significantly impacts prognosis, treatment strategies, and patient outcomes in bladder cancer care. Always consult healthcare professionals for personalized advice and treatment options.